Yes.
One more question. Thank you very much. George Hulse, I'm one of the vice presidents of Emblem Health. As the panelists all know, over the next 3 years, there'll be $7.5 billion that the government CMS has given through 1115 waiver to help communities like East New York and Brownsville. I'd like to know, how are you going to impact any of those dollars? The money's going to be going to Health Plan Solutions. Number one, do you have a relationship with Health Plan Solutions, since they'll be the ones distributing the money? And number two, for the audience, this money will be spent on non-clinical services. So it won't be going to hospitals. It'll be going to the 80% of what we call healthcare that is non-clinical. Someone talked about transportation. This money will be for transportation. This money will be for community-based organizations that have not, disproportionately not received the money. So I'd like to know from the panelists, do you have a relationship with those community-based organizations? Do you have a relationship with Health Plan Solutions? And how will that money be spent? Because disproportionately, I've been a vice president for 25 years, and we've talked about East New York, Brownsville, Bed-Stuy, and Brooklyn for 25 years, and there have been overwhelmingly very little improvement in the health care of these communities. What are we doing wrong for 25 years? Thank you.
So, Mr. Hulse, that's a great question, and we have Public Health Solutions here today. And the third panel will really dive into their participation in this work. They're a critical payer, $7.5 billion. Well, they're not getting all of that, but there is over $150 million to build infrastructure in Brooklyn, Queens, and Manhattan, and Public Health Solutions is here to talk a little bit about that. So we'll leave your question to later on, if that's okay. Thank you very much, panel. We really appreciate the time. But you want to wrap up, Michelle? Okay.
Okay, I think in closing, I just want to thank the A team, because we are the A team. That being took we first, right? So, not that B and C doesn't matter, but we want to just give everyone the opportunity to just love on our panelists, and thank you so much for your engaging participation. And we hope that this, again, will have planted seeds that will flourish in your respective positions, communities, and patient engagement. Have a wonderful day. Thank you so much. Thank you.
Thank you very much. As they move from the stage. All right, as they move from the stage, I think what's important is, let me allow them to take a photograph. What's important is a few pointers that came out of the conversation. Language, we got to get language access going. Patient-centered care, we got to listen to the patients. A lot of members, patients, do not have advocacy. And so the clinicians, the social service providers have to pull information from these individuals. So we are excited to have our next speaker. She's no stranger to this property. She is indeed the queen of the hill. She is Dr. Sandra Scott. But before Dr. Sandra Scott comes up, we're going to invite Mr. Senator Kevin Parker. He is New York State Senator for the 21st District. Senator. Okay, perfect. And Khadijah will introduce her, Senator Parker.
That's all right. Good morning. How's everybody doing? I am State Senator Kevin Parker. I represent the 21st District in Brooklyn, which is Flatbush and East Flatbush, Dippers Park, Canarsie, Mill Basin, Bergen Beach, Marine Park. Right? I'm the chairman of the Energy and Telecommunications Committee, as well as the majority whip in the New York State Senate. And let me thank Cavs off the rip for their partnership, and thank you, Sister Khadija, for your offer to give a big graduation graduation, they give my whole bio. They start out like, he used to work for David Dinkins, you know, when he was the mayor. He used to work for the first Governor Cuomo, worked for Una Clark in the city council, worked for Nick Perry in the assembly, worked for Hillary Clinton, worked for Carl McCall. Little girl stood up in the front of the class and said, "What's the matter, mister? You can't keep a job?" So I was not going to do that this morning. I wasn't doing that with y'all. Right? So I was like, let me just introduce myself, give it to you nice, short, and sweet. Look, we all know that our health is our wealth, right? And that's why we're here, right? But how you get to health is really the question. And that's where the folks in this room come in. And so really just happy to be a partner in this conversation. And this is not the conversation, this is a conversation that hopefully will lead to more conversations that then also will lead to better performance, because when you know better, you should be able to do better. And certainly I think that there is a space for elected officials in that conversation and in that action. However, we need you to tell us what needs to be done, right? You have very few people who are healthcare providers in the state legislature. Most notably, we have a state assemblywoman who's actually an active nurse. Assemblywoman Karina Reyes is in the Bronx, is literally an active nurse. But short of her, there's most of us who are engaged in making decisions on the policy end of this really don't have the day-to-day bedside and care responsibilities that the people in this room have and the understandings. So we need to be told, we need to be educated, and so that's part of why I'm here today. I missed the free breakfast, but I did come because I did want to hear this conversation and figure out how we can partner to make care better across our great state. So Cavs, thank you all of our partners. And a lot of people here who I've worked with and know and are friends, and certainly George Hulse from Emblem is somebody who's been a partner of mine probably for over 20 years since I've been elected, and certainly really looking to be supportive of One Brooklyn Health. As people may or may not understand, One Brooklyn Health came out of work that the state did in order to save our healthcare and make sure that we had entities here. And there are transitions happening in the healthcare sector every single day. One of the biggest ones happening now at Downstate, which continues to be a process that has to go forward. The hospital's not going away, right? I know there's people talking about it's going to close, but it is going to transform, right? And it is going to go from an outpatient model, from an inpatient model to an outpatient model. And hopefully we'll be able to get some federal funds to be able to look at how do we build some of the crumbling infrastructure that's there. But I think more importantly, there needs to be continue to be a community conversation around the services that are being provided there. And from my perspective, and again, this is where the conversation comes in, first looking at the things that Downstate actually does really, really well, right? And then secondarily, looking at things that are not provided other places, right? And then three, looking at the needs of the community, right? So I think that becomes the nexus and the metrics that we need to look at in order to make some decisions around what happens next at Downstate. But certainly, as a policymaker, we need to be educated, we need to be informed, and we need to be part of these conversations so that we can hear what's going on. But certainly just like leave things as they are, unfortunately, it's not one of the options that we really have. We really, every moment, need to be continuing to move forward and working together to make sure that we're providing the best care. So again, thank you all for not seeing a robbery and taking your Monday to have these important conversations, and please see me as a partner. God bless you.
Thank you much, Senator Parker. So just want to highlight for a little housekeeping. We have a sheet of paper that has our hashtag CavsNet Network. So